Ever wonder how something like just a bit of irritating skin on your dog's elbow could actually be a sign, a clue pointing to something much bigger going on inside?
It's a really interesting connection, isn't it?
Okay, let's unpack this. We're about to take a deep dive into a condition called diabetic hepatopathy in dogs. It really highlights this whole thing.
Exactly. And we've gathered quite a bit of detailed info on it. Our goal isn't just, definitions.
Right.
We want to look at the whole picture, how it shows up, what might cause it, how it's diagnosed, treatment approaches, the whole web.
Precisely. Think of this deep dive as like your shortcut to getting a good handle on diabetic hepatopathy.
Mhm.
We'll pull out the most crucial bits so you can understand this pretty complex issue without getting bogged down.
Okay, so let's start with the basics.
Huh.
Diabetic hepatopathy. What exactly is it?
Well, simply put, it's a serious liver problem, degenerative. The technical term is vascular hepatopathy, VH for short.
Right, VH.
And what's key about VH is this buildup. You get fat and glycogen accumulating inside the liver cells.
Like they're getting overloaded.
Exactly. Overloaded. And that eventually damages the cells, makes the liver feel kind of bumpy, nodular.
And it's often seen alongside two other things, which are really important pieces of the puzzle.
Yes. Pressure point dermatosis.
Those skin problems, yeah. Elbows, hocks, places they lie on.
And the other big one, of course, is diabetes mellitus, DM.
But here's a really interesting twist you mentioned earlier.
Yeah, this is fascinating. Our sources say sometimes the liver changes, the VH, can actually appear before the skin issues or the diabetes is even diagnosed.
Which is pretty counterintuitive, isn't it? Like the liver's signaling trouble ahead of the more obvious signs.
Kind of like the body's warning system is a bit out of order.
That's so important for catching things early, potentially. And we should also mention phenobarbital.
Oh, right. Long-term use of pheno, that seizure medication.
Yeah, that can sometimes cause similar liver changes too in some dogs.
Good point. Now, who tends to get this? Are there certain dogs more at risk?
It typically shows up in middle-aged to older dogs. There might be a slight leaning towards males being affected more often, perhaps. And it's definitely something recognized in Shih Tzus specifically.
Interesting. Okay, so let's talk about what you might actually see. What are the signs an owner might notice?
Well, the onset can be quite sudden, actually.
Really?
Yeah. And initially, maybe not many obvious signs,
Hmm.
but common things owners report are weight loss,
Without trying.
right, unexplained weight loss, lethargy, just seeming tired, drinking a lot more water and needing to pee more often.
PBD.
Exactly, PPD. And poor appetite, maybe even anorexia, not eating at all, sometimes diarrhea or vomiting too.
And you might see jaundice, that yellowish tinge.
Yes, that can happen. Yellowish gums, whites of the eyes. And there's a really unusual sign too.
Ah, the lameness one.
Yeah, lameness. But it's not joint pain usually. It can actually be because of painful cracks, fissures on their foot pads.
Ouch. That sounds really specific.
It is. Definitely something to watch for.
Okay, so that's what an owner might see. What about when the vet examines the dog?
Well, they'll likely pick up on the lethargy, maybe poor overall body condition. And those sore feet and elbow lesions can really impact how the dog stands or moves.
Right.
They might see the jaundice, like we said. The skin issue itself, the technical name is superficial necrolytic dermatitis.
SND.
Right. And feeling the abdomen, the liver size.
Yeah.
It varies. Could be normal, could feel small, could feel enlarged.
So not always one specific finding there.
No. And it's pretty uncommon, but you might feel an irregular liver edge. Fluid in the abdomen is also rare with this.
Okay, so let's get into the why. What's actually going on underneath? What are the suspected causes, the risk factors?
The main theory revolves around low amino acid levels in the blood. That's called hypoaminoacidemia.
Amino acids, the body's building blocks.
Exactly. And the current thinking is that a shortage of these is a big player in both the skin problems and maybe the liver changes too.
Okay. Are there other things involved?
Well, there are suggestions that maybe deficiencies in zinc or certain fatty acids or even niacin might play a secondary role, sort of contributing factors.
Right. Now, I know there was an early idea about high glucose levels, hyperglucogonemia.
Yes, that was proposed as a key driver. Glucagon's a hormone, but the evidence is a bit inconsistent.
Oh, how so?
Well, only about 30 to 40% of dogs with this actually show high glucagon levels when tested.
Huh. Why might that be?
Could be issues with the tests themselves, the assays. Or maybe it's about how the liver processes glucagon differently in these dogs. And actual glucagon-producing tumors in the pancreas, They're confirmed in less than a quarter of cases.
So not the main explanation for most dogs, then.
It doesn't seem to be the universal cause, no. But what is a key factor, definitely, is insulin-resistant diabetes mellitus.
Ah, the diabetes connection again. So the body not responding properly to insulin.
Exactly. That insulin resistance seems crucial. It can really mess with how other organs, like the liver, function.
Makes sense. And we should also remember similar skin lesions can pop up with other liver issues, right?
Yes, definitely. Especially liver disease caused by that long-term phenobarbital use we mentioned,
Hmm.
or much less commonly, chronic exposure to mycotoxins, those fungal toxins.
Okay, so lots of potential factors interacting. Now, diagnosis. If a vet suspects this, how do they figure it out? What else might look similar?
Good question. There are several other liver conditions they need to rule out first. The differential diagnoses.
Like what?
Things like cirrhosis, that's severe scarring and loss of liver structure, chronic hepatitis, which is ongoing inflammation and liver cell death,
Okay.
copper-associated hepatopathy,
Right.
where too much copper builds up, a rare thing called diffuse nodular hyperplasia, and another type of VH, the glycogen type, which is mainly just glycogen buildup.
So they need to distinguish diabetic hepatopathy from those. How do standard tests help? Blood work, urine tests.
Routine tests give important clues. The CBC, complete blood count, might show mild to moderate anemia and not enough red blood cells. It could be non-regenerative, meaning the body isn't making enough new ones, or maybe mildly regenerative. You might also see small red cells, microcytosis, and often increased neutrophils, a type of white blood cell.
Which suggests infection.
Often, yeah. Probably secondary infections from those skin lesions.
And the chemistry panel, what does that usually show?
You often see high liver enzymes, especially ALP alkaline phosphatase. That's usually quite elevated.
Very high.
Can be significantly high, yes. Also, you might find low total protein and low albumin levels in the blood. Blood sugar, if tested after fasting, can be normal or high. Cholesterol and BUN levels can vary.
What about the urinalysis? Anything specific there?
Sometimes you find ammonium biurate crystals in the urine. Seeing those can definitely point towards liver dysfunction.
Are there other more specific lab tests?
Yes, total bile acids are often increased, another sign the liver isn't working right. Insulin levels, interestingly, are often inappropriately high, reflecting that insulin resistance. Plasma glucagon, as we said, can be high, but it's inconsistent. But a really key finding, especially if the dog has those skin lesions.
The amino acids.
Exactly. Significantly reduced plasma amino acid levels. Very characteristic, particularly with the skin signs.
And even if the liver signs came first, the amino acids might still be low.
Yes, often low then too, maybe just not quite as dramatically reduced as when the skin is affected.
Okay, what about looking inside? Imaging like x-rays or ultrasound?
Imaging helps build the picture. X-rays might show the liver size variation we talked about, small, normal, or large, usually no fluid seen.
And ultrasound, is that more revealing?
Ultrasound can often give more detail, yeah. You might see an irregular liver margin. And there's a pattern sometimes described as a Swiss cheese pattern.
Swiss cheese, what does that look like?
It means you see multiple dark, sort of fluid-like areas scattered within the brighter liver tissue background. It's quite suggestive.
But not only seen in this condition.
Correct. It's not exclusive. You can see it with other severe liver problems too. Sometimes you just see a generally bumpy texture, nodularity, but that's not always obvious on ultrasound either.
And those pancreatic tumors, are they easy to spot on ultrasound?
Actually, no. They're only found with imaging in less than 20% of these dogs, even if they are present.
So imaging gives clues, but isn't the final answer. What is needed for a definitive diagnosis?
To be really sure, you need to look at the liver tissue itself. A fine needle aspirate, taking a small sample with a needle, can show those cell changes, the VH with glycogen and fat.
Okay.
But a liver biopsy, taking a larger piece of tissue, is generally preferred for a definitive diagnosis.
How is that usually done?
Ideally, laparoscopically. Keyhole surgery. It's less invasive than open surgery, which you want to avoid if possible, because those skin lesions can make healing difficult.
Makes sense.
Though if the skin lesions are really extensive and scream S&D, maybe a needle biopsy is enough in some cases.
And if imaging does show a mass on the pancreas?
Then that should definitely be removed surgically, if possible, and sent off for analysis to see what it is, if it's making hormones.
And a skin biopsy, too.
Yes, essential to confirm it's superficial necrolytic dermatitis, especially since those lesions are such a key part of the syndrome.
Okay, diagnosis confirmed. Let's talk treatment. What are the main strategies?
Diet is absolutely central, really critical.
What kind of diet?
High-quality protein is key, and energy dense. For dogs that just won't eat, Assisted feeding might be needed, maybe a feeding tube, or even IV nutrition in severe cases.
And what if the liver's struggling so much they develop hepatic encephalopathy, HE, that neurological issue?
Right, if HE develops, the focus shifts slightly.
Yeah.
You use things like lactulose and maybe metronidazole to help the body handle nitrogen waste products better. And a special liver-specific prescription diet becomes important then.
You mentioned high-quality protein. What about extra protein or amino acids?
Yes, that's often a cornerstone of treatment. Oral protein supplementation, and sometimes even periodic IV infusions of amino acids directly.
Okay, tell me about the oral options.
Egg yolks are one suggestion.
Yeah.
Maybe 3 to 6 yolks a day, depending on the dog's size and needs.
This is yolks.
Yes. Another option is anabolic whey protein powder, like athletes use.
Whey protein. Okay.
A general guideline might be 1 scoop or serving usually around 7 grams of protein, 25-35 calories for every 5 to 7 kilos of body weight mixed in the food. But if HE is a concern, you'd use this carefully alongside that liver-specific diet.
And the IV amino acids, how does that work?
These are special solutions, different concentrations, like 3.5% up to 10%. A common one is a 10% crystalline amino acid solution.
Okay.
A typical dose might be something like 25 milliliters per kilogram of body weight, given slowly, usually over 8 to 12 hours, ideally through a large central vein like the jugular,
Why centrally?
because the solutions can be irritating. But if there are clotting issues, maybe a long peripheral catheter, you do have to watch out, though even giving amino acids this way carries a small risk of triggering HE.
That's a tricky balance. How quickly do the skin lesions respond to this kind of amino acid therapy?
Sometimes, quite remarkably, you might see improvement after just 1 IV treatment.
Wow.
If not, the protocol is often to repeat it every 7 to 10 days, maybe up to 4 times total.
And if there's still no response?
Unfortunately, if the skin doesn't improve after that series of treatments, the prognosis tends to be quite poor. It's a bad sign.
Are there other supplements that help?
Yes, essential fatty acids, omega-3s especially, often recommended at double the usual dose.
Double dose, okay. And you mentioned something for rare tumor cases.
Ah, yes. For those uncommon metastatic glucagon-producing tumors, there's a long-acting drug called octreotide. It's a somatostatin analog. It can help manage the hormone effects, but it's extremely expensive.
Right, cost is a big factor there. Okay, moving beyond diet and supplements, what about medications?
Well, number 1 is managing the diabetes. Insulin therapy is non-negotiable.
Absolutely.
And we cover the diet. Then you need to treat secondary infections, skin, nail beds, wherever they occur.
So antibiotics, antifungals.
Yes, systemic ones if needed. And medicated baths can be really helpful too.
Zinc and niacinamide came up again in the sources for meds.
They did. Zinc supplementation can be beneficial, usually 2 to 4 milligrams per kilograms of elemental zinc once a day. But there's a specific type, zinc methionine, you should avoid if HE is a risk.
Okay. And niacinamide?
That's often given at 250 to 500 milligrams per dog, twice a day. Higher dose generally for dogs over 10 kilograms. Need to watch for side effects and definitely avoid any extended release versions.
What about treating the skin lesions topically?
If infections are under control but inflammation persists, you might cautiously use topical steroids. But systemic steroids, pills, or injections are generally a bad idea.
Why's that?
They can worsen HE, increase risk of stomach ulcers, infections, and make the diabetes much harder to control. Just too many downsides.
Got it. Any other meds?
Ketoconazole can be used for secondary yeast infections. It also has some anti-inflammatory and anti-itch effects, which is a bonus. And that long-acting octreotide we mentioned, it pops up again, theoretically, based on the hormone ideas. But again, the cost is usually prohibitive. Ursodeoxycholic acid, or UDCA, is another one often used.
What does UDCA do?
It helps with bile flow and has some protective effects on liver cells. Dose is usually 10 to 15 kilograms daily, split into 2 doses with food.
And antioxidants. They seem important for liver health generally.
Absolutely. Vitamin E is common, 10 IU per kilogram daily, and estedenosylmethionine, same.
Same, right.
Dose for same is around 20 kilograms daily, given on an empty stomach. It's a good antioxidant, but has other beneficial effects too. And crucially, if phenobarbital is involved.
Stop the pheno.
Discontinue it, yes, if it's deemed a contributing factor.
Okay, that's a lot of potential treatments. Are there interactions to worry about?
Yes, definitely need to be mindful. High protein, as we said, can potentially trigger HE. Ketoconazole can have side effects and drug interactions. Niacinamide and zinc can cause issues if doses are too high or the dog is sensitive.
So careful monitoring is key. What does follow-up look like?
With very regular monitoring, especially at first. Physical exams may be weekly to monthly initially. checking a response to amino acids, looking for infections.
And the diabetes?
Daily glucose monitoring at home is vital. Strict management. Plus, regular lab work, initially CBC, chemistry, urinalysis, probably weekly to monthly to track progress and liver values.
What complications can pop up during treatment?
Well, those concentrated IV amino acid solutions can sometimes cause thrombophlebitis, inflamed veins, potentially clots.
Okay.
Ketoacidosis, that serious diabetes complication, isn't common here but possible. HEI is a big risk we've discussed. Sepsis, that body-wide infection, is a danger because of the diabetes and the open skin lesions. And just managing the pain from the skin lesions themselves is important.
Right. So bringing it all together, what's the expected course, the overall outlook?
It's variable. Some dogs do achieve remission of the skin lesions with treatment, which is great. Sometimes that can last maybe around 2 years.
That's hopeful.
It is. But unfortunately for many dogs, the disease just keeps progressing despite treatment. And sadly, euthanasia becomes the necessary option.
Even if the liver itself improves.
Yes. Interestingly, the sources mentioned the liver lesions can sometimes improve with treatment, even if the skin problems prove really stubborn and ultimately limit the dog's quality of life. It's a tough one.
Wow. So diabetic hepatopathy. It's really a complex picture, isn't it? This serious liver degeneration, so tightly linked with diabetes and those very specific, often painful skin issues.
Absolutely. And diagnosing it takes detective work, looking at the signs, lab results, imaging, and ultimately getting those tissue samples.
And the treatment is definitely not simple. It's multifaceted, specialized diet, that crucial amino acid support, strict diabetes control, managing infections.
It really hammers home how interconnected everything is in the body, doesn't it? How a metabolic issue like diabetes can ripple out and affect the skin, the liver.
It really does, which makes you think, doesn't it? How often might we just see a surface symptom, like a skin patch, and not fully grasp the deeper metabolic storm brewing underneath? It really highlights the challenge in spotting and managing these complex, interwoven conditions in our pets.